Mind-boggling.
Excellent.
It kind of wowed me.
Absolutely unbelievable.
Fascinating, and I can't wait to give it a go.
It's great to see some new technology out there and actually think about the future of the NHS and where digital health fits in with that.
We're just at the beginning, for the first time, of being able to use digital technology to empower patients, to improve medicine, and perhaps what's most important to the NHS, do so whilst reducing costs.
What the future actually holds, especially on that last presentation with regards to virtual reality, is mind-boggling.
And what I think we don't do enough of in the North East is share what we do, because we've actually got lots of really good practice.
What's happening now through the use of modern technology, like my wearable, and like many of the other things that we're talking about today, are beginning to give patients an informed sense of what's happening in their own biology.
We can build up really quite sophisticated amounts of data, and then we can match that to the patient's condition, we can match that to the type of drugs they're taking, their sleeping patterns, their age. Age is really important.
Biophotonic treatments for macular eye disease is eye-opening. You'll excuse the pun. It really is, and what this man has done has blown me away.
We're trying to find a way to visualise the enormous amounts of genome data that the Sanger Centre puts out every year, and we're helping researchers try to find patterns within that data that will help them do things like find the causes of dementia. I'm going to take you through a little bit of explanation about what virtual reality is, but as Angela said, please come and try it, because in a nutshell, it's a headset which enables you to add a third dimension.
What I found really, really interesting in it today was the genome and actually where that kind of 3D technology may be able to fit in terms of patient experience in the future. The concept's fantastic, but how do we reach out and get those clinicians on that journey?
I think it's important for the NHS to think about social media as a means of new ways of creating healthcare and engaging citizens in their own healthcare.
The problem is when you're stuck at desk and that, you tend to look inwards an awful lot, and it is that little bit of chance just to hear what people are doing elsewhere. It just generates some ideas really to take back to base and move forward with.
I can say to one person here, I've got this really good idea but don't know what to do, and they can say, well, we're doing that, and then we collaborate. So these events are perfect for that sort of thing.
It's not about the technology, it's about the people and getting the clinicians behind it.
Very inspiring, very exciting. I had no idea all this was going on in the world of healthcare.
The drug companies will have the chance for real-time mass clinical trials. For example, if I am wearing a very cool-looking wrist device, a wristwatch, which measures all the vital signs, you can see how I'm performing taking a given drug, for example, when it's a hot day, when it's a cold day, when I have a head cold, when I don't. This is data that's never before been available.
App Movement is a platform through which you can commission, design, and have built a location-based review app about anything that you want for iPhone and Android for free. The only thing that you need to do is to find enough other people to say that your idea is a good idea and that they would use this service. It's literally a map with pins on the map that signify places on that map that a woman has been and breastfed in public.
When you're thinking about digital technologies, think about them second. Think about people first, tech second, and think about digital as an enabler, not as an end in itself.
I think in a digital age, as a patient, I have a right to expect that my information will be there at the point of need and not blocked off by somebody in the IT department.
Technology and medicine are in convergence. Technology is disrupting taxis and air travel and hotels. It's disrupting medicine. The trick is to try and use that for good.